Prostate cancer, early symptoms you should never ignore. Did you know that 1 in 8 men will face prostate cancer in their lifetime? It is the second most common cancer among men and one of the leading causes of cancer-related death. The frightening part is that prostate cancer often develops silently, with no clear symptoms until it has reached an advanced stage, when treatment becomes much harder and the chances of a cure are much lower. But here's the good news. This is one of the cancers where early detection makes an enormous difference. Statistics show that 9 out of 10 men diagnosed early can successfully manage and overcome the disease. That means recognizing the early warning signs is the key to protecting your health and your life. So what exactly is prostate cancer? The prostate is a small gland located just below the bladder and surrounding the urethra. Its job is to produce seminal fluid, which nourishes and transports sperm. When the cells in this gland begin to grow abnormally and turn cancerous, they can form a tumor and spread to other parts of the body, most commonly the bones and spine. Because of the prostate's location and function, early symptoms are often very subtle and easily mistaken for other less serious conditions like prostate enlargement or urinary tract infections. That's why so many men miss the golden window for detecting the disease while it's still manageable. Instead of brushing off small bodily changes as just normal aging, we need to learn how to listen carefully and distinguish which are early warning signs and which are simply temporary issues. In today's video, I'm going to share with you the 10 early warning signs of prostate cancer that you should never ignore. Some may seem simple, like waking up multiple times at night to urinate or struggling to start your urine stream, yet they can actually be silent messages from your body. Other symptoms, such as persistent back pain, blood in the urine, or unexplained weight loss, are often overlooked until the disease has already advanced. My goal here is not to cause fear, but to give you knowledge and control. By knowing these signs, you'll be able to take action early, see a doctor in time, and protect not only your own health, but also the well-being of the men you love. So, let's dive into the very first sign, one of the most common symptoms and an early warning that many men tend to dismiss. Sign number 1, frequent urination, especially at night, or nocturia. Normally, a healthy man may urinate about 6 to 8 times a day, and waking up once during the night is still considered normal. But when the prostate begins to enlarge abnormally, whether from a benign cause or something more serious, it can press against the urethra, disrupting the natural flow of urine.
As a result, many men find themselves waking up repeatedly during the night to use the bathroom, sometimes 2, 3, or even more times. This condition is known as nocturia. Beyond just disrupting sleep, nocturia leaves men feeling tired the next morning and, over time, seriously impacts quality of life by draining energy day after day. In addition to frequent nighttime trips, some men also experience the sensation that their bladder never fully empties. Even right after urinating, they still feel the urge to go again. This discomfort is sometimes mistaken for digestive issues or simply drinking too much water, but in reality, it can be a warning sign coming from the prostate. The important thing is not to dismiss this as just part of getting older. Of course, nocturia can be caused by other factors such as diabetes, heart disease, or the side effects of diuretic medications. But if the problem persists, especially when combined with other symptoms like urgency, difficulty starting urination, or pain while urinating, that's the time to see your doctor without delay. Sign number 2, difficulty urinating. This is not just a temporary inconvenience, but a recurring issue that gradually becomes more noticeable and directly affects daily life. Many men start to realize that initiating urination has become slow and difficult. They may have to wait a long time before the flow begins, or strain to get it started. Once it does, the stream is often weak, intermittent, or stops and starts. Most concerning is the feeling that the bladder never fully empties, so even after leaving the bathroom, they feel the urge to go again almost immediately. These symptoms occur because a tumor or enlarged prostate presses against the urethra, the tube that carries urine out of the body. When this passageway narrows, urination becomes difficult and puts extra pressure on the bladder. Over time, this can lead to urinary tract infections, bladder stones, or even kidney damage. However, because these symptoms can also appear in benign conditions like benign prostatic hyperplasia, BPH, many men dismiss them or assume it's just part of getting older. Unfortunately, this false reassurance is one of the reasons prostate cancer is often detected in later stages. It's also worth noting that in addition to difficulty urinating, some men also experience pain or burning sensation while urinating, or lingering discomfort and heaviness in the lower abdomen even after finishing. These warning signs should never be ignored. Remember, urination is a basic function we all do every day. When it starts to feel abnormal, that's your body sending a distress signal. Listening to that signal could protect not only your health, but also your life.
Sign number 3, urinary urgency and incontinence. This is when you feel a sudden, powerful urge to urinate that comes on so quickly you can't delay, sometimes leading to leakage before you reach the bathroom. In the early stages, many men assume this is simply a normal part of aging or a weak bladder. But in reality, when the prostate enlarges or a tumor presses against the urethra, the bladder has to work harder and becomes unusually sensitive. As a result, it gets triggered more easily and sends urgent signals, even when it's not very full. What makes this especially concerning is how directly it impacts quality of life. Imagine being in a meeting, driving your car, or simply taking a walk in the park. Suddenly you're forced to rush to the restroom. The constant fear of not making it in time weighs heavily, leading many men to limit outings, avoid social activities, and gradually withdraw from the life they once enjoyed. In some cases, urinary urgency is accompanied by incontinence, leakage of urine, even when you don't intend it. This doesn't just cause discomfort and embarrassment, but also increases the risk of skin irritation or infections due to constant dampness. It's important to note that urgency and incontinence aren't always caused by prostate cancer. They can also result from urinary tract infections, benign prostate enlargement, or bladder nerve disorders. However, if these issues happen frequently, persist over time, and are paired with other warning signs like difficulty urinating, frequent nighttime trips to the bathroom, or painful urination, then they should never be ignored. Sign number 4, painful or burning urination. Many men at first assume this is just a urinary tract infection or simply the result of not drinking enough water. But if this symptom repeats itself and persists, especially in men over 50, it may actually be an early warning sign of prostate cancer. The cause often lies in an enlarged prostate or the presence of a tumor pressing against the urethra, the tube that carries urine out of the body. This pressure makes urination difficult and painful. In addition, when cancer cells spread into the bladder or urethra, they can trigger inflammation and irritation, leading to a burning sensation every time you urinate. What's important to understand is that this type of pain is not the same as the mild, temporary discomfort you might feel after eating too much salty food or drinking too little water. Instead, it's a sharp, burning pain felt deep inside, often persistent, and not relieved even when you increase your fluid intake. Some men even describe it as feeling like a knife cut each time urine passes.
This condition not only causes physical discomfort, but also takes a toll on mental well-being. Many men begin to dread using the restroom or deliberately drink less water to avoid the pain. Unfortunately, this leads to dehydration, makes the urine more concentrated, and only worsens the problem. It's important to remember that painful urination can have many possible causes.
urinary tract infections, prostatitis, kidney stones, or cancer. That's why only a medical evaluation can determine the true reason. Delaying a checkup may allow the condition to worsen or cause you to miss the critical window for detecting cancer early. Never forget, your body always has ways of sending warning signals. Pain while urinating is one of those signals, a clear reminder that you need to act now before it's too late. Sign number 5. Blood in urine or semen, hematuria or hematurspermia. Normally, healthy urine is pale yellow. If you notice that your urine turns pink, red, or dark brown, it means blood is present. Likewise, if semen changes color, shifting from its usual clear or milky white to tinged with pink or brown, that's also something that should never be ignored. There are several potential causes for this, such as urinary tract infections, kidney stones, prostatitis, or minor injuries. The dangerous part, however, is that prostate cancer can also be the culprit. As cancer cells grow, they can invade the tiny blood vessels surrounding the prostate, causing blood to leak into the urethra or semen. The problem is that many men tend to dismiss this, assuming it's just temporary, especially if the blood disappears after a few trips to the bathroom. But in reality, any trace of blood in urine or semen should be treated as a serious warning sign. If cancer is the underlying cause, delaying an evaluation allows the disease to progress silently into stages that are much harder to treat. Beyond the physical concern, this symptom also carries a heavy emotional burden. Many men feel anxious, embarrassed, or even avoid sexual intimacy. Some delay seeing a doctor because they're uncomfortable talking about it. Unfortunately, this hesitation only increases the risk of missing the critical window for early detection. The important thing to remember is this: even if blood appears just once, it should never be ignored. A doctor may order urine tests, a PSA test, ultrasound, or even a biopsy to pinpoint the cause. If it turns out to be an infection or kidney stone, appropriate treatment will resolve the issue. But if it's prostate cancer, catching it early can dramatically improve the chances of successful treatment. Sign number 6. Persistent pain in the back, hips, or bones. When it comes to prostate cancer, many people only think about urinary symptoms, but another important warning sign, especially as the disease begins to advance, is a dull, lingering pain in the back, hips, or bones.
The reason is that prostate cancer often spreads to the bones, most commonly the spine, pelvis, and hips. When cancer cells invade these areas, they weaken bone structure, causing deep, aching pain that usually doesn't go away with rest or over-the-counter pain relievers. It's important to note that this type of pain feels very different from discomfort caused by spinal degeneration or muscle strain after physical activity. Pain from bone metastasis is persistent, long-lasting, and often worsens at night or when lying down. Many men describe it as a sensation of the pain drilling into the bone, impossible to ease with ordinary measures. In fact, for some men, unexplained back or hip pain is what finally brings them to the doctor, only then to discover prostate cancer. This shows how crucial it is to pay close attention to unusual, ongoing pain. Beyond pain, bone metastasis can also lead to other complications, such as limb weakness, numbness, or even pathological fractures, bones breaking under minimal pressure. These complications are not only painful, but also pose a serious threat to mobility and overall quality of life. Of course, not every case of back pain is cancer. Age, poor posture, or heavy physical work can also cause aches and stiffness. But if you experience pain lasting more than 2 to 3 weeks that doesn't improve with rest and continues to worsen, especially if it's combined with urinary symptoms, that's a strong signal to see your doctor right away. Sign number 7. Painful ejaculation. This is a sensitive symptom that many men hesitate to share with their partner or even with their doctor. Unfortunately, that silence can cause underlying conditions, including prostate cancer, to go unnoticed. In the early stages, the discomfort may feel mild, almost like light pressure in the pelvic area or urethra. But over time, the pain can become more pronounced, spreading to the testicles or lower back. Some men describe it as a burning sensation, sharp stabbing pain, or deep discomfort that robs them of the desire to engage in sexual activity. This condition doesn't just affect physical health, it also takes a heavy toll on emotional well-being and married life. Men may feel stressed, anxious, or even fearful at the thought of sexual activity. Over time, this can lead to avoiding intimacy altogether, weakening emotional connection, and placing significant strain on the relationship.
It's important to note that painful ejaculation is not always caused by prostate cancer. It can also be linked to infections, prostatitis, or even follow medical procedures such as a biopsy. However, if this symptom happens repeatedly, lasts over time, and especially if it's combined with other warning signs like difficulty urinating, frequent urination, or lower back pain, it should never be ignored. The most important step is overcoming the psychological barrier and speaking openly with a doctor. Simple tests, such as a PSA blood test, a digital rectal exam, or an ultrasound can quickly help identify the cause. And if prostate cancer is the reason, detecting it early opens the door to more effective treatments that are less invasive and can preserve quality of life, including sexual health. Sign number 8, rectal discomfort or bowel changes. Prostate cancer doesn't just affect urination or sexual function. Sometimes it also shows up as symptoms in the rectum and digestive system. The reason is simple. The prostate sits directly in front of the rectum. When it enlarges or develops a tumor, it can press against the rectum, causing ongoing discomfort. Many men describe this sensation as if something is constantly pressing in the anal area, leading to a frequent urge to move the bowels even when the rectum is empty. Others notice difficulty passing stool, narrower stools than usual, or the feeling that they haven't completely emptied after a bowel movement. At first, these symptoms may be mistaken for common digestive issues like constipation or hemorrhoids. In reality, however, they may be subtle warning signs from the prostate. Beyond discomfort, advanced prostate cancer can cause more noticeable changes in bowel habits, needing to move the bowels multiple times a day, alternating between diarrhea and constipation, or even experiencing urinary and bowel disturbances at the same time. In some progressing cases, the tumor can partially block the bowel, leading to abdominal pain, bloating, or even emergency hospital visits. The danger is that many men either dismiss or feel embarrassed about symptoms related to the rectal area. Out of reluctance to talk to a doctor, they miss the golden window for early detection. That's why if you notice unusual changes in your bowel habits, especially when combined with the urinary symptoms we discussed earlier, treat them as signs that need immediate medical attention. Sign number 9. Unexplained weight loss. Weight loss is often seen as a positive sign if you're dieting or exercising. But when pounds start to drop quickly without a clear reason, especially in men over 50, it can be an early warning sign of prostate cancer. The reason lies in the behavior of cancer cells, which multiply rapidly and consume large amounts of the body's energy and nutrients. Your body also works harder than usual to fight the disease, creating a metabolic imbalance. The result is significant weight loss, even if your diet hasn't changed, or sometimes even if you're eating the same or more than before. What's important to understand is that weight loss caused by cancer is very different from losing weight through diet or exercise. In this case, the pounds drop along with muscle mass, leaving the body weaker and more exhausted. Clothes become looser, muscles shrink, and energy levels plummet, making everyday activities much harder to manage. Many men mistakenly see weight loss as a good thing, especially if they've always wanted to slim down. But when it comes with other symptoms, such as urinary changes, back pain, or blood in the urine, it's a red flag. In fact, Prostate cancer has often been discovered in men who went to the doctor simply because of rapid, unexplained weight loss. It's also worth stressing that unintentional weight loss can be linked to a range of other conditions, from diabetes and thyroid disorders to digestive diseases. But no matter the cause, sudden weight loss always requires serious medical evaluation. Think of the scale as your health companion. If you notice you've lost more than 5 to 10% of your body weight within just a few months without trying, treat it as a warning sign and get checked right away. Detecting prostate cancer at this stage greatly improves the chance of effective, less invasive treatment while preserving your quality of life.
Sign number 10. Persistent fatigue. This isn't ordinary tiredness. It's a deep, overwhelming exhaustion that doesn't improve even after plenty of rest. The cause lies in the way cancer cells consume the body's energy and nutrients while also releasing inflammatory substances that disrupt normal metabolism. The body is forced to fight the disease while running on an energy deficit, leading to overall breakdown. As a result, men often feel weak, sluggish, and easily drained even when performing simple daily tasks. One key difference is that cancer-related fatigue does not go away with sleep or short rest. A man may sleep through the night yet wake up feeling as though he never rested at all. Concentration becomes difficult, daytime sleepiness sets in, and gradually he loses the ability to take part in everyday activities, from work and exercise to family life. This condition also has a strong impact on mental health. Many men feel discouraged, lose motivation, and believe they are aging faster than normal. In reality, this could be the body's cry for help, warning that something serious may be happening inside. The key point is that persistent fatigue should never be ignored. It can be linked to many other health problems, such as anemia, diabetes, heart disease, or thyroid disorders. But if fatigue is combined with the symptoms we've already discussed, like difficulty urinating, back pain, or unexplained weight loss, it's time to see a doctor right away to rule out or detect prostate cancer early. We've now gone through the 10 early warning signs of prostate cancer that you should never ignore. From what may seem like minor inconveniences to more serious signals, each one is your body's silent way of sounding the alarm. The most important thing I want you to remember is this: prostate cancer doesn't appear overnight. It is a slow, silent process that can develop over many years, often without the person realizing it. That's why early detection can make all the difference between keeping the disease under control and allowing it to progress to a dangerous stage. Statistics show that 9 out of 10 men, when diagnosed early, can successfully manage and overcome prostate cancer. That number isn't meant to frighten you. It's meant to remind you that hope is always there, as long as you act in time. If you or a loved one notice one or more of the 10 symptoms we've just discussed, don't delay. Don't assume it's just a normal part of aging, and don't wait until things get worse before seeking help. Every day of hesitation could mean losing the golden opportunity for early detection and effective treatment. Finding it early doesn't just improve treatment outcomes, it helps you maintain your quality of life, independence, and joy with your family. Beyond medical checkups, you can also take steps right now to protect your prostate health. A healthy lifestyle is your strongest shield. Eat plenty of leafy greens, fatty fish, and whole grains. Exercise regularly, maintain a healthy weight, and limit red meat and alcohol. And most importantly, keep up with routine health screenings, including PSA tests and prostate exams, especially once you turn 50 or if you have a family history of the disease. The choices you make today are the key to protecting your health tomorrow. Leave a comment below and share, out of the 10 signs we covered today, which one feels most familiar to you. Is it frequent nighttime urination, persistent back pain, or that lingering fatigue that just won't go away. Your story could become both encouragement and a valuable warning for thousands of other men watching this video. And if you found this video helpful, don't forget to hit like, subscribe to the channel, and turn on the notification bell. Every week, we'll bring you practical, easy-to-follow health tips designed especially for people over 60 in the US, so you can live healthier, more confident, and more independent every single day.